Hello, welcome to the next in our series of Asian Health Talks. My name is Bryant Lin. I am a co-director and co-founder of the Center for Asian Health Research and Education, and I'm very pleased to bring you this series of talks, co-sponsored by the Stanford Health Library. And the talks overall are sponsored by the Vincent V.C. Wu Foundation. Great thanks to the foundation for supporting this series. Today we have a talk on health, illness, and social support in the Asian American community, brought to you by Dr. Grace Yu. Grace Yu, PhD, MPH, is professor and former chair of Asian American Studies at San Francisco State University. She's a medical sociologist with a background in public health who has spent 30 years teaching and researching about health, illness, and social support among Asian Americans. She is the co-author with Barbara Kim of Caring Across Generations, The Linked Lives of Korean American Families, which received the 2015 Asia and Asian American Section Best Book Award from the American Sociological Society. She is also co-editor of 3 books, including the Encyclopedia of Asian Americans Today with Edith Chen, the Handbook of Asian American Health with Mai Nung Lee and Alan Oda, and Koreans in America, History, Identity, and Community. She has also published widely in journals such as Health Education and Behavior, Supportive Cancer Center, Supportive Cancer Care, Ethnicity and Disease, and Journal of Immigrant and Minority Health. Please join me in welcoming Dr. Yu. Thanks for joining us today, Dr. Yu.
Thank you, Dr. Lin, and thank you, Stanford, for hosting this presentation. In my presentations, I always like to see who's in the audience. So in the chat feature, can you list your name and the city that you're zooming from, and what brings you to this presentation? So the prompt is, I am in this presentation because, and so I would just love to see who's in our audience. Again, I'm a medical sociologist, and I love connections with other people, and so I'd love to see who's in our audience. So if you wouldn't mind putting your name in the chat and what city you're zooming from and what brings you to this presentation, that would be great. Great. So the chat feature should be on the below on your Zoom, and just sort of click on there, and let's see who will who's in our Zoom. Geronimo San Jose, wondering how I can improve spiritual care for Asian American patients and families. That's amazing. May in Los Altos. Edith Chen, I'm zooming from Culver City. I'm here in this presentation to learn more about API health issues. Alex Long from Houston, Texas, welcome. This is great. We've got folks from outside of the area that are also zooming in. This is fantastic. Jiyoung Kim from Palo Alto, I'm interested in Asian health. Charlotte from Berkeley, interested in learning about resources. Jean Yi from Stanford Interpreter Service. Bill Ng from Sacramento, longtime interest in Asian American health issues. And Nicole, I'm in Sunnyvale. Both my partner and I are Asian Americans with aging parents dealing with terminal and non-terminal issues, health issues. Arnav, I'm in this presentation because I'm a department chair and assistant professor of public health at Cal State East Bay, and my research is on Asian American health disparities. And Cynthia, I'm in Millbrae and currently work at Stanford Healthcare, interested about Asian health and how to offer family support. Well, welcome everyone. It's so awesome to see everybody's name through this chat. Karen Ng from Honolulu, who's an educator and social support group facilitator. Karen So from Houston. Wow, we've got folks from out of the area. And Tracy Al from Stanford Healthcare, nursing quality, API ERG. Well, welcome everybody, and feel free to continually put stuff in the chat. It's great to see you all on Zoom this evening. So again, my presentation is on health, illness, and social support in the Asian American community. As Dr. Lin has mentioned, I'm a medical sociologist and also a professor in Asian American studies, and I've been studying for about 30 years various health issues and aging issues in the Asian American community, and really looking at the concept of social support. Now, I just wanted to talk about, this is me this last week, and this is my elderly mom, and she was exposed to COVID, and we knew it was a matter of days that she would come down with COVID, and there was no one home, and my niece and sister were away. And everyone was a bit frantic. Who can we call if something happens to my mom. And what we found out during COVID is that it's really hard to find folks that might be willing to support my mom because of the fear of catching COVID. And so I flew down to Southern California last week to be with my mother. My mother eventually did come down with COVID, and I've been with my mom for the last 8 days. I've been masking and keeping windows open, and knock on wood, I've not tested. Knock on wood, I've not gotten COVID. But of course, while in quarantine with my mother, though, there have been things breaking down, like the toilet. In fact, I got an alert from the water company that there was a 1,200 gallon leak occurring in the house. And so we turned off the water, and we manually put water in the toilet bowl several times a day for 5 days. And by the way, a plumber would not come to our house because of COVID, because there was someone with COVID. And so we didn't have a plumber. I envisioned that we would not have a plumber for the next 10 days. And so I was determined to fix the toilet. I watched 4 hours of YouTube and received lots of encouragement from my family and friends via text. And I fixed it. I can fix a toilet. So I can be of support to people. And I am grateful for the informational support of YouTube. But I wanted to share this because I wanted to say that even during this time period, during COVID, there are many kinds of supports that we need. And for me, during this week, my mother's been improving. It's really been a plumber, a plumber. And thank goodness for YouTube and the informational support I received. I watched about four hours, and I was able to fix my mother's toilet. So anyways, again, welcome to this presentation. There are several learning outcomes that we'll be doing today. We're going to explore the context and research on Asian Americans' health, illness, and social support. We're going to review some past studies that I've been a part of on Asian American health and illness and social support. And then we're going to identify and discuss supportive and caring Asian American communities. And I also welcome, by the way, anyone throughout my presentation, any questions you might have. I'd love to engage with the audience. And so I'll be presenting, but I'm hoping that we'll have enough time for some Q&A. So these are the learning outcomes tonight that we'll be exploring. So this is social support illness, by the way. We know that people with larger social networks and quality support have been shown to recover from illness faster and are better able to cope with illness than people who do not have social support. And this is widely known. So many different studies that have affirmed this finding. And so I've always been interested in looking at social support, and and especially in the context of the life course. These are top 10 stressful life events that some of us and many of us may experience in our lifetime. Birth, illness, and family, and illness and injury among our family, marriage and divorce, job loss, illness and injury, retirement, death of a spouse, death of a close family member, and a family member experiencing jail or prison time. These are top stressful life events. What we know as we encounter stress, what is an amazing coping resource is social support. And social support, by the way, there are many domains of social support, and it's been defined as emotional, instrumental, informational, and appraisal. And for many years, scientists have recognized this positive relationship between social support and health across all age groups. And there are three main types of supportive interactions. That's emotional, and emotional would be sort of talking to someone when you're stressed out, and that sort of that in that interaction. And informational support would be information that you might receive. I would say, with getting my toilet fixed for my mother, and YouTube became informational support for me. And then instrumental support. Instrumental support may be a meal prepared for you, or a ride to the doctor's office. That's instrumental support. And so in addition to social support, there are social networks, and social networks represents these interpersonal ties that provide support. Again, they can be the ties that can provide various types of support, whether it's emotional, informational, tangible, companionship, or financial. It can involve family and friendship ties, and neighbors and service providers and community organizations. And it can be examined by its configuration, but also the actual perceived and availability of social support. And so there's a lot of research on social networks. There's a whole area called social network analysis. I wanted to really talk about Asian American health and illness and social support, and just really sharing my research from the last 25 years that I've done and published. I also wanted to share the various social cultural challenges, shifts, and opportunities. And I have to say that for Asian Americans, the greatest thing that we encounter in various interactions is our stereotypes. The stereotypes of Asian Americans often being stereotyped as the healthy model minority, meaning that we don't have any health problems, or the forever foreigner that we could never be from the United States. Or how about as of recent, during the pandemic, seen as the China virus. And then just the stereotype that we're this monolithic group. And then finally, that we're never considered a population that needs support. And that's huge. These stereotypes can impact the support that we receive from others. So this is a really important understanding in terms of stereotypes, because it affects all kinds of healthcare encounters. In fact, I'm just going to give you a very short story about my father at Kaiser. When he would go to Kaiser, he would always tell everyone at Kaiser, at every healthcare encounter, my daughter is a public health professor at San Francisco State University. And at every encounter, he would say that. And I thought, some people might have thought it was bragging, but I know my father was doing that so that the healthcare providers could humanize him, could really just see him. But he would do that all the time. And in fact, when I would enter a Kaiser with my dad, they would say, "Are you that daughter? Are you that daughter?" And again, it was my way of my father showing, that he should be respected. And again, this is in the face of so many stereotypes that Asian Americans may face. I want to make mention that the older Asian American population is growing. We can see this projection for 2019 to 2060. It is a population that's growing, and it's a population that is also primarily foreign-born or immigrants. And so it's a population also that experiences various health issues, comorbidities, chronic illnesses. And by the way, I wanted to just share briefly some statistics on Asian Americans and health, because I think these various statistics impact social support and the need for social support. Asian Americans have higher odds of having diabetes compared to non-Hispanic whites. And Filipino Americans have nearly 3 times the odds of having diabetes compared to non-Hispanic whites. And Korean Americans and Vietnamese Americans have higher rates of lacking a usual source of care than non-Hispanic whites. Also, studies have shown that Korean Americans delay seeking care more often than both non-Hispanic whites and Asians overall. And that Korean Americans and Filipino Americans delay medications more often than Asians overall. And again, these are just some statistics I wanted to share, because all of that impacts social support. Now, when I first started looking at social support, I really, about 20 years ago, I was really looking at older Asian Americans, and I was really studying older Chinese and Korean Americans and the meaning of family support for this population. And we had done focus groups in San Francisco with about 52 elders, and we asked them, what does social support mean to you? What does family support mean to you? And what we found in our study is that immigration was bringing changes to people's concepts around support. Many of folks were living separately from their adult children, and there was a need to extend their social network beyond their family. And that also, too, in this immigration process, that family changes were also occurring, that parents were no longer authority figures in families, and elderly immigrants were more independent. And so there was this changed perspective of what family social support should be, and that they were becoming much more bicultural. Again, this was a study that we'd done almost 2 decades ago, really looking at social support. And we had followed up, in other studies and publications that we'd done with this population. We were examining the types of social support and the actual sources of social support in older Chinese and Korean immigrants in the San Francisco area. And we realized that language support was a key support that was a need for this population. And that also that older Chinese and Korean immigrants really had a small number of actual sources of support. So their social network for support was actually quite small. And their main source of support were really their adult children, the adult children who were helping them with personal situations. However, their friends were they were there for general information, advice, and companionship, and that these elders also used formal services and the ethnic immigrant church for support when needed or offered. Now I want to transition. I've studied again elders, but I've also studied adult children of immigrants. And this is a book that I had co-written with Dr. Barbara Kim at Cal State Long Beach, who's also another sociologist. It's called Caring Across Generations, the Linked Lives of Korean American Families. And it studied the dynamics of adult children and their aging parents. And just to let you know, the children of immigrants, children with at least one foreign-born parent now comprise almost 1/4 of U.S. children under the age of 18. And immigrant parents are kind of a unique population in that, in addition to hardships around finances and English proficiency, immigrant parents just have a lot going on their plate. There's been studies that show that they have significantly higher levels of parental aggravation and lack knowledge about supportive resources on parenting than non-immigrant parents. Also, we know in the United States, immigrants constantly struggle with belonging, psychological stress, distress, and discrimination. So there's a lot happening for children of immigrants growing up in a home with immigrant parents. And so this was what the book was about. And we were also taking a look at basically how does being a child of an immigrant shape your life course from childhood to middle adulthood. And in particular for this presentation, how do children of immigrants care over the life course? And we really looked at how caring for many children of immigrants started in childhood as language and cultural brokers. And the caring continued as aging parents faced declining health. And again, our study was grounded in everyday realities. Older Asian Americans, again, are primarily an immigrant population. And studies have shown that compared to whites, Asian Americans are more likely to state that their doctor did not listen to them, understand their background, and did not adequately educate and inform them about major medical decisions. And they also report less referrals to cancer screenings, counseling, and diabetic services. And many Asian American respondents are more likely to attribute these poor doctor-patient relationships to their race and limited English ability, and believe that they would be treated with more respect by their doctor if they were white. And again, important statistics and research to understand as we think about the role of adult children. And so, as I'd mentioned, we had followed the stories of Korean Americans, 137 Korean Americans who had at least one parent over the age of 55, who resided in the San Francisco Bay Area or the Los Angeles area, and who were either 1.5 or second generation. And we had done qualitative in-depth interviews with this population. And, a key theme in what we collected was that children were language brokers. And from a very young age, children of immigrants became familiar with the English language and American culture faster. And from a young age, they had taken on roles from translating, writing legal letters, filling out business forms, accompanying parents to doctor offices to interpret medical information and interact with various officials, as well as helping parents at a young age in their business or at home. And so what we found is that, this is sort of over the life course that the children of immigrants really had a unique role as language and cultural brokers. And so when their parents faced declining health, they continued this role. And the work of adult children was immigrants' parents' vulnerability, being ignored or neglected by healthcare providers, stimulated many kinds of advocacy by adult children. And respondents helped immigrant parents from gaining access to healthcare through Medicare, or helping their parents cope with and manage their illnesses, or to search for information on the internet, communicating a diagnosis and necessary treatments between doctors and immigrant parents, or translating necessary information. So the work of adult children, again, this is an example of gaining access to health. This is Michelle. At the time she was 30 years old, she said, He had cancer, but because he didn't have health insurance, we didn't know. I graduated from college and I came back to LA in December. Nobody told me he was sick. Nobody. I didn't think he even knew he was sick. He thought he had indigestion. He had liver cancer, but nobody knew. And when I came down, he was getting worse and worse, but he didn't have insurance. So I took him to the LA County Hospital. By the time they admitted him, 80% of his liver was cancerous. So there was no way that he could live. So they told us, your dad has 3 to 6 months, go home and wait for him to die. And again, this is Michelle, again, becoming an advocate for her father and trying to gain access to health. This is another example of cultural and language brokering encounter. This is Lois, who was 45 years old at the time. She said, I remember just standing there. My mom's lying on the exam table saying, what did she just say? And I just lost all words. I couldn't even remember. My mind went totally blank. I'm sure it took me like 5 minutes to come up with words. I remember saying, Mom, you've got to hold on. I have to think of the words. And then, of course, I found the word cancer. And so this is Lois describing how her mom getting diagnosed with cancer, having to process that information, and then translate that information and convey that to her mother. This is also Paul, who was 48 years old at the time, talking about being a child of an immigrant means working to get quality health care for their parent. He talks about, I actually used my documentary experience to advocate for my mom with the healthcare system. It took her like almost 5 months to see a neurologist. I got fed up with this, so I brought my video camera. And that particular morning, she was scheduled to see a neurologist. But again, she was routed to another floor. I had my camera on my shoulder, and I said, I just want to document my mom's healthcare to make sure she sees somebody because her health is degenerating. So they did 2 things. They called the sheriff, and they found 2 neurologists on that same day, and they spent 40 minutes with her, and she got the best care. But they also called the sheriff, so it was a little sacrifice for me. And so again, Paul talks about being an advocate for his mother, but also kind of the troubles he encounters by being such a strong advocate. So, in the book that we had published multiple other things about what it meant to be a child of an immigrant, but our chapter on health really demonstrated that the adult children of immigrants were a key support network, and that the children of immigrants do both invisible and visible work, especially as parents face aging and health concerns. And this is rooted in systemic inequities that really exist in the healthcare system for immigrants, and the need to help parents advocate and navigate these systems. So that was a study that we'd done with 137 the children of Korean Americans. And so I've been doing other studies because I've been wanting to understand what's it like helping an aging parent with type 2 diabetes. And so we have done a study. I've done a study with UCSF School of Nursing and some colleagues on looking at Filipino Americans and Chinese Americans, aging parents and adult children, and that sort of relationship around looking at family support around type 2 diabetes. And so this is just some of our preliminary findings that we've been looking at in terms of older Asian Americans with type 2 diabetes and their adult child. Really, there's really few studies, by the way, looking at Asian American families and health. There are really few studies, like you can only count them on your hand. But like no studies on Asian Americans and type 2 diabetes in families, even though the numbers that, type 2 diabetes is increasing in our community, and diabetes prevalence, of course, increases with age. But in our study, we found that there were non-linear stages that families would encounter, adult child and their aging parent. And one was independence, that there's this need for independence in terms of adult children not trying to manage their aging parents' type 2 diabetes. And then kind of a change, being a transitional phase where there is tension around management, around type 2 diabetes, and then eventual partnership and eventual stepping in. And so what we found is that these stages were nonlinear, but there was a process in how an adult child could support their aging parent with type 2 diabetes. It wasn't like, let's go support right now, but there was this process between a parent and their child in terms of support. So that's one of our studies we've done. Another study I wanted to share with this community that I'm speaking to is destigmatizing hepatitis B in the Asian American community and lessons learned from the San Francisco Hepatitis B Free campaign. I want to say that sometimes support in our community is hindered by silences around many illnesses and diseases in our community. And I think because there are silences around it, it's sometimes hard to gain support. But I want to talk about this really unique health campaign that occurred here in San Francisco, because it delivered really messages through public service announcements that were educational, entertaining, and culturally sensitive, and they were presented by respected leaders. And there you see, on the right of your screen, you see some of their ads of "Be a Hero," save lives, and so, get tested, get vaccinated. That's been part of their campaign. It's been going on for about 14 years. But what I found as a medical sociologist so amazing about this campaign were the public disclosures by public officials about, having hepatitis B. And I wanted to share, by the way, and that was sort of my key findings, is that we can move away from stigma. Stigma is a label or a judgment that often occurs sometimes when people sort of disclose that they have a particular health condition. And so I felt this campaign really destigmatized hepatitis B. And one way they did talk about hepatitis B is that it wasn't about bad people or bad behavior. That was a key finding. And that they were also moving stigma aside by normalizing this discussion of hepatitis B by utilizing public disclosures. And then finally motivating action by emphasizing solutions, that we can do something about this. And so again, this campaign has been so unique. I wanted to share a little bit about the campaign. Again, it's over 14 years old, it's still going, but I felt this public disclosure by this newscaster, Alan Wang, was kind of amazing. So I wanted to share this.
It's ABC 7 News at 11. And thousands gathered in San Francisco to celebrate Asian heritage and join the fight against an illness that infects 1 in 10 Asian people. And crowds filled San Francisco's Civic Center Plaza today for the annual Asian Heritage Street Celebration. Admission was free, and so were screenings for hepatitis B. 1 in 10 Asians is infected with the virus, but the Hep B Free campaign, started here in San Francisco, has been making huge strides in fighting the epidemic, which can lead to liver cancer. Recently, the Assistant Secretary for the U.S. Department of Health and Human Services announced a nationwide action plan.
So he has a plan where he wants to put hepatitis to the forefront, and that's combating hepatitis B and C. So it's a program, again, physician education, community education.
And I happen to be that 1 in 10 of Asian people infected with hepatitis B. I was infected at birth, but since I was screened, I was able to do something about it. I take a pill. I went from 13 million copies of the virus attacking my liver to 0. I'm undetectable.
Good for you. Yeah. And of course, you're wearing the lapel pin in honor of everyone wanting to get that screening.
Exactly, the Hepatitis B Free campaign.
So again, I've appreciated this campaign because of public disclosures like that. And again, breaking silences around hepatitis B. And I think this campaign has been incredibly influential, again, because of people's public disclosures. So let me go on to my next slide. So when we think about social support, health illness in Asian Americans, we need more research, by the way, and we really need more research. We need to study social networks, we need to study subpopulations, and we need to think about various illnesses and conditions. And I really do think that we really need to look at the impact of COVID-19 and anti-Asian hate in our community, and sort of how support has evolved and support needs. And also one area that I haven't fully jumped into, which I think we need more understanding and research, is the need for more understanding around gender and cultural differences and help seeking and social support as it relates to relational concerns of not wanting to burden or worry others. And as result, because people keep things to themselves, people eventually just keep their problems to themselves and maybe not receive any social support. And so these are some things I'm really intrigued by, interested in doing some more, and that I feel like we need more information on. But I also want to say, during this pandemic and this time of anti-Asian hate, this has been an opportunity for creating communities of care. And I want to say, during the pandemic, we've seen supportive and caring communities such as Asian American nonprofits, Asian American churches, and then nonprofits serving the Asian American community throughout the United States. I think this has been a time of that. And I have to say that for many Asian Americans, this has maybe been, a time to remember one's own past history. In my own family, my family experienced utter certainty, panic, and fear during the Korean War. As my dad said, the Korean War brought out the selfish nature of many people. And it was natural just to focus on your own family and not think about others. But also, my family members have also said that in the fleeing during the Korean War, there were also people that acted unselfishly during this time period. And my grandmother, for example, was on the last train out of Busan, in which civilians were fleeing for their lives. And she arrived, and the train was packed beyond measure, and she got on a train with my uncle, who was a baby at the time. And once she got onto the train, there were hordes of people that were climbing on top of the train, and they were trying to push my grandmother off the train. And an older man had witnessed this, and he said loudly to the crowd, "Do not throw this mother and baby off the train. Even though we are fleeing from war, we cannot push a mom and her baby off a train. I will make room for her." And so somehow this older man exhibited extraordinary courage and empathy and leadership. And so as my grandmother entered her 90s in the throes of her dementia, this is a story she would repeat over and over again, that she needed to go thank this man for saving her life and saving my uncle's life. And she wanted to personally thank him. So I'd like to think that our own crisis of the pandemic has brought out more compassion and care, even when we have been concerned about our own safety. And again, I want to recognize all the nonprofits that have been doing this work, delivering meals to Asian elders. I know there's several organizations in the San Francisco Bay Area that have been delivering meals to elders, and really also concentrating on various Asian American communities. But also, in the literature, there has been research on Asian American churches also providing informational, emotional, and spiritual support during this time period. So I really want to recognize that work of support, the work of various nonprofits and churches. But I also want to say that this crisis of the pandemic has also brought out care among younger people. And this is API Youth Rising. They're an organization started by middle schoolers, and their mission is to take small actions to make positive change in our communities. And they were started in March 2021. And they've risen to about 1,200 young people, and they rally to bring awareness about the increasing xenophobia against Asian Americans. And so I just want to share this small clip, and then
we are back with our series Generation Next, and a group of friends who are proving that it is never too early to enact change. NBC News Now anchor Savannah Sellers had the chance to talk with them. Good morning.
Good morning. That's so true. Never too early, because the girls I'm about to introduce you to are middle schoolers, but they're also activists in the AAPI community, educating other kids and some of us adults along the way.
If adults don't do anything, we have to do something. And if we don't do something now, it's not going to change.
For teens Meena Fedor, Ashi Gupta, Si Uri, and Charlie Trenkle, activism was never in their plans.
We never really started off like, I'm going to found an organization, we're going to be a group, we're going to get that 501c3. It was more of like a friend thing.
These 8th graders are the founders of AAPI Youth Rising, an organization focused on taking small actions to make a big difference. Each of them impacted by the rise in attacks against Asian Americans during the pandemic.
Once, I think we were somewhere, and my mom told us not to speak in Mandarin, which was like, I was kind of confused at that time, but then I realized like later why. They said something about me going back to my own country. It hurts a lot because I've been here.
After speaking out in a virtual school assembly, Mina decided to gather people in real life by organizing a rally with the help of friends last March in Berkeley, California.
Is this what it means to be Asian American youth right now? That would be a great idea, just to, I don't know, do something fun and, make something and have a positive message for the API community.
The rally drew a crowd of 1,200, giving them the confidence to double down on their work.
What makes you decide, hey, now this is really an organization?
Seeing the impact the rally made, it just really made us realize that we can make a difference.
So tell me about the work that you're doing.
The 1 by 180 pledge, we ask people to support team just one day, only one day of AAPI history out of the 180 instructional days of the school year.
These young women crafted the material for that course themselves, and they'll be the ones teaching it in their school, with other schools following soon.
So if we're taught what we're experiencing and what AAPI people have contributed to our community, it would be very important for everyone to know about, because then we know that AAPI people actually belong in America, and we're not like foreigners or the model minority.
They also joined other student-led coalitions in support of AB 101, a bill that would require every public high school student in California to take an ethnic studies course, signed by Governor Gavin Newsom last October.
What was it like? I mean, you're all middle schoolers getting involved in a legislative process.
The biggest or most impactful actions you can take are often supporting legislative bills. I had to find out how the California legal system works. I had to figure all this stuff out.
What is it like to fit this into school schedules, after school activities?
I mean, I think of it as like a part-time job, even though I never had a job before.
It's a job they take seriously, just recently helping to bring this mural to life, honoring AAPI heroes, and partnering with American Girl on the 2022 Girl of the Year, the first Chinese American doll to take the honor. Young people showing you don't have to be an adult to make change.
What's your hope when other middle schoolers see what you guys are doing?
Just talk to people, get the word out about whatever issue it is that you feel really passionate about fighting for. You don't have to create a club or create an organization, create a group to affect other people. Normalizing this sensitive conversation in everyday life is also going to be extremely helpful in creating a change.
Now, the AAPI course that this group created is now in full swing. Get this, they're already booked to teach themselves in 3 states. And they're encouraging young students to join in teaching their own classes and at their own schools. It's really cool what they're doing.
Anyways, I hope you enjoyed that short clip. I was inspired by this young group, API Youth Rising, and the work they've been doing to create change again during the pandemic and during the anti-Asian hate.
We are back with our series Generation Next and a group of friends.
I want to make mention, I've been involved in my own sort of mutual aid during the pandemic. This is myself at Grocery Outlet in March 2020, when we could not find a mask. And I didn't know how to sew. And this was the first mask that I had sewn, and I had given it to folks at Grocery Outlet, but also joining the anti-sewing squad during the pandemic. In fact, I've been part of the anti-sewing squad. Again, I didn't know how to sew, but I learned to sew. And we've made 350,000 masks. And at the very beginning of this pandemic, we were making masks for Muni bus drivers. And it's been an amazing process supporting folks and also teaching some students. I've taught some students how to sew masks, and they've learned this new skill. And so it's been an amazing process of mutual aid and amazing process at a time of crisis to support others. And again, I want to say that the pandemic and anti-Asian hate can also be this time to cultivate and create supportive communities. And I'm grateful to be part of the community that I had joined, which was the anti-sewing squad. Anyways, that's the end of my presentation.
Great. Thanks so much, Dr. Yu. Fantastic talk. And thank you so much for coming today. Appreciate your talk and appreciate all your collaboration with Stanford Care. And please join us. Our next talk for the audience is actually next week. I think Karina Kim, our program coordinator, put it in the chat. So stay tuned for that. And great thanks to the Vincent V.C. Wu Foundation for sponsoring this series. Thank you so much. Have a great week.
Great. Thank you.